Good evening. As we're getting set up here, I just want to welcome everyone. My name is Haley Thompson. I have a few roles. For tonight's purposes, I'm the director of Checkup. That's Wayne State University's Center for Health Equity and Community Knowledge in Urban Populations. So this is an effort that we have with a number of community partners. I really want to acknowledge SEMHA tonight, Southeast Michigan Health Association, that partners with us on this work, and many other organizations as well. I know you're represented out here tonight. Our goal within the university is to facilitate more effective, transparent community academic partnerships, right? So how can we better work? For me, as somebody who is a faculty member and professor at Wayne State University, how can we come to our work with different community partners with more transparency and invite more leadership, not just partnership, but leadership. Because I certainly firmly believe that not all the expertise, the genius, the brilliance lies within our university, right? They lie in our communities. I'm very well aware of that. I was just talking with somebody about this the other day. I had the honor of hearing Dr. Christine Burkett. You know who Dr. Christine Burkett is? She is Detroit's Director of Digital Equity. And she's awesome. So, and I'm sure at some point, you'll get to hear from her. And she grew up in Detroit. And we were talking about that. I'm not from Detroit, I'm from Brooklyn, I'm from East Flatbush. But there's a lot of places that East Flatbush bears a lot of similarity to Detroit. And I know, and I tell everybody, I'm smart enough. I work hard, but I'm not special, right? And there's a lot of people, because I had certain opportunities and I had certain things come my way, that I am here today and I can be a professor at a university. But I know there's a lot of people like me in our communities who could have been professors at universities or get PhDs or MDs. So we want to be able to tap into that. I know this is something that Lisa and others feel really strongly about. So I'll just leave it at that. I'm really excited for tonight's program of community health workers. If you want to learn more about Checkup, just go online, Checkup with a check-up.wayne.edu. So that's what it is, checkup.wayne.edu. If you just Google it, put in Checkup at Wayne State University, you'll find it. And we have a YouTube channel, we have a Facebook page, so we do all those things. Forgive me, I'm tired. It's the end of the day, so I'm hanging in there. But yeah, so I'm going to turn it over to Lisa Braddix at this point, who has been a steering committee chair for our group, some of our work here at Checkup, and is a really big part of what we have been growing at Checkup, our Detroit Community Health Equity Alliance. So it's a coalition of over 20 organizations and residents who come together to start building and leveraging resources that we all have towards certain health equity targets. And before I get off, I just want to thank the Eastside Community Network and Studemeyer for having us here today. So thank you all for being here.
So good evening, everyone. I'm so glad to be here tonight. We have spent some time preparing for this, and we have looked forward to this for quite some time. So welcome everyone to our panel of Community Health Worker Career Pathways, Opportunities for Community-Based Organizations. So I'm looking forward to us having a really robust discussion about this topic. I trust that you all maybe are interested maybe in becoming a community health worker, or as a community health worker, you're looking to take some next steps in your career, or just kind of learn what it is all about so you can spread the word. So I'm glad that we're here and gathered, and we have an outstanding panel collected to answer some questions for us tonight. So without further ado, because I know that we have some limited time, I'm going to actually, instead of reading everyone's bios, I'm going to have them introduce themselves and tell you all about what they do and how they became community health workers, because you're going to find out really quickly that this is the right bunch of people that we have gathered here today. So I'm going to begin here with Shannon Lijewski.
Good afternoon, everybody. Shannon Lijewski. I'm a community health worker. Done this work for about 22 years now, mostly in northern rural Michigan, working in prisoner reentry and homelessness and housing insecurity, food insecurity. I am our CHW and principal at Everyday Life Consulting. So we're a Michigan-based national CHW firm that is owned by CHWs and operated by CHWs. So very excited to be here, and thank you for having me.
Good evening, Gary Ringer, community health worker for about the past 4 or 5 years. was doing this work, essentially as a nonprofit professional, servicing the needs of the community, but going above and beyond. And met the current executive director of the National Association of Community Health Workers, and was kind of brainstorming with her some things that I was trying to do from a pilot project perspective. And she said, hey, you are a community health worker. The work that you're doing is essential to our community and servicing the members within our neighborhoods from a health equity perspective. So just glad to be here and look forward to addressing your questions.
Thank you. Good evening, everyone. My name is Adrienne Bulger. I am a community health advocate, community health worker at Hope Village Revitalization. Okay, I primarily focus on hypertension, heart health, diabetes, high cholesterol, and childhood asthma. I first got into this role as a certified community health worker 2 years ago. However, I have been doing this work for a long time. I was a volunteer for Hope Village Revitalization for 3 years, teaching yoga at the farmer's market. And they saw the value and care that I have for community and that I was truly dedicated at the root and brought me on board. And I've been going forward ever since.
Right, outstanding. So let's just to level set and make sure that everyone has an understanding of what a community health worker is. Why don't we start there? So what is a community health worker? And anyone can start and we'll just rotate.
Yeah, I got the mic, so I'll jump at it. Community health workers are frontline public health professionals that assist residents in minimizing health inequities. They may be individuals who might be suffering or have dealt with the same issues, whether it be homelessness, whether it be substance use disorder, whether it's chronic disease management. And those individuals have gone through the process of navigating the healthcare system and are assisting residents in doing those same things.
I would just add that we are peer-to-peer and we are a skilled trade. Not an entry-level workforce, not a paraprofessional, but rather a skilled trade based on our lived experience and kind of our community-based dynamic and needs.
I can see this is going to be fun. They already covered it. However, we are community health workers. We look just like you. We interact with everyday folks just like you. We are everyday folks, liaisons, as we've said, in the healthcare medical professional. We do it all.
Okay. So now that we've kind of level set a little bit, what about impact? What impact do community health workers have on the communities that they serve?
In Hope Village community, we have a very unique population. We have a lot of seniors, retired people, but we also have a special concern with hypertension and heart disease. More than 55 of our residents are living with heart disease, and more than 53% of them are living with hypertension. When we began to implement some of these programs, I got down with the community members and said, you know what, I'm going to do this with you. The blood pressure programs, I began to remove sodium from my diet. And so the impact has been that when people see people motivated and willing to do this, do these programs, they're more likely to be excited about their progress. Look what I did. My numbers are better. I'm sleeping better. I'm eating better. I'm working out. And so I actively do these things with community members to let them know that they're not alone. So the impact that I have had has shown up in the continuous participants and engagement in our community, and we are healthier together.
Oh, you go, enough said, mic drop. Okay.
I will do one more, just and saying that one of the things that we talk about a lot nationally as a national board member is that we're trying to make the invisible visible. So one of the things that is often hard to quantify is what we call the hope maker. So we can help walk alongside individuals, again, because the peer-to-peer often have lived experience, and really empower the self-management and the future outlook. When we're constantly working in crisis, it's sometimes hard to see that future outlook. And then more importantly, assist with the struggling well is kind of another way to look at it. You know, we can't solve anybody's problems, but we can help empower what success looks like for each family.
And I'm gonna add to that, because Shannon spoke to something important to me, that lived experience piece. My lived experience, former home builder, just retired from the fire department. And within that, I've seen housing inequities firsthand on a regular basis. So a lot of people have become accustomed to disinvestment, being neglected with being serviced from the standpoint of helping to eradicate certain housing inequities that are present in their community, in their home, that they may not know there are resources for. So I'm a strong advocate for anything and everything that can assist an individual, primarily where they're at their home. And a lot of times we hear about the importance of what's going on outside of your home, but we spend more times inside of buildings, inside of our homes, approximately 90%. So what can we do to make sure that wherever you're at, whenever you're there, it's a place that can help to enhance your quality of life?
Right. So we talked about and heard about some of the examples of what you all do, kind of really engaging people one-on-one, or, you know, groups of people, and kind of living and encouraging them in their health journeys. But what about the impact at a systemic level? We know that, you know, the whole reason why checkup exists, and the whole reason why community health workers exist really is all about inequities in our health, and all about inequities in social determinants and social influences of health. So in terms of your work and in the work of community health workers on a systemic level, what is the impact?
Great question. As I was reviewing the questions, this is one that kind of got me a little bit. In the Hope Village community, we have the NSO organization, Neighborhood Service Organization, and they have a ton of resources there. If you live there, you have access to resources. However, there are folks that live across the street that do not have the same access, and it is also visible, as Shannon said, making the invisible visible. And so being able to say, I know that this exists. How do we overcome this systemic issue or misrepresentation together? And so we partner with the neighborhood communities. We reach out to our partners at Hope Village Revitalization. We have Ms. Juanita Maxwell, who is our neighborhood navigator. I'm missing one of her acronyms, but she's our neighborhood resource navigator. And partnering with her, we are able to say, okay, who has housing? There's this family that needs housing. How are we able to help them? And as you heard, my focus is on the health and wellness, but with the social determinants of health. How can we help these families without bias? So to put myself in that position, what do I need if I need help? What should the help look like? What kind of patient should I have in helping people reach these resources, and understanding that this may not be the best service for this type of family need or family dynamic, but who do I know that does have it? And it's sort of like if I need to make a phone call to a friend and say, what do I do? How can I help make this better? I know the person that I'm going to go to. So I would look to find ways to put myself in the position of the person that I'm helping, and then find the best resources to work. And does that make sense? Okay, as long as it makes sense, there we go.
I would just add to it that community health workers, you know, we use our influence. You know, we haven't forgotten about our community. So even when I'm on the national platform, or Gary's on the national platform, you know, we're collectively elevating the voice. It is making headway. This is going to be a very impactful year for community health workers. People are listening to the true need of the community. There's a big trend in what we call the resident's voice. And part of that empowerment is saying, well, I am part of the resident's voice. And when I'm speaking on behalf of the community, I'm speaking on behalf of trusted members of the community that I've worked with for years. And so it's not just Shannon's voice. And that's something I think that's really powerful. And when you aggregate that up, it's even bigger and more impactful.
Yeah, and that systemic impact is what's really important, because who better to speak to it and to make the invisible visible than somebody that has that lived experience, that has that exposure to the inequity, then that network to support. Hey, yeah, or this is where you can get that data. This is an individual you can talk to. So from a systemic level, it's not just data. It's a story that goes along with it. It's the family that goes along with it. It's a lived experience that goes along with it. And I think that's extremely impactful.
Absolutely, absolutely. So switching gears for just a little bit, I know that many of our audience probably came in with some background, maybe of, some surface knowledge about what a community health worker is, and we've addressed that. But a lot of people feel like community health workers are specific to hospitals or clinics or that side of health. But we know that there's so many facets to what CHWs do and how they can be helpful in the health of communities and individuals. So in terms of community-based organizations, how can community-based organizations like, for example, Eastside Community Network as a community development corporation, how can community-based organizations benefit from having a CHW?
I think community-based organizations can directly benefit by being right there when the issue occurs. A lot of times, like I said, I'm a retired firefighter, and I didn't find out about community health workers until I was almost 19 years on the job at a conference out of town with other leaders from various communities. And I was just in awe because I see inequity on a regular basis, but didn't know that there were resources that I could possibly lend to these households or to these other organizations that I partner with that could say, hey, there's opportunities to provide, trusted members to assist them in navigating healthcare, in navigating chronic disease, in navigating homelessness, navigating anything and everything that could be prohibiting an individual from having a higher quality of life. So I think community-based organizations can tremendously benefit from having CHWs directly where they are.
I would say community-based organizations are the #1 employer of community health workers, inclusion of faith-based organizations, and the majority of roles are still predominantly women of color and volunteer-based, unpaid positions. And so part of the advocacy is elevating the fact, again, that it's a profession. We are classified under the Department of Labor, and it really is a career. The other thing that we have to think about is community-based organizations historically are very skilled at hiring of and from the community. You're hiring people with a big heart, and community health workers, you really can't do this job unless you care, because it is a really, really tough job. And it helps to bridge that gap again back to the healthcare system, who, historically has struggled with hiring individuals coming from their community. And so that's our biggest, I would say, opportunity statement, is that we can still continue to be that bridge. The other thing we have in Michigan, which is unique to Michigan, is our Medicaid contracts and our billable entities. There's a lot of mechanisms to help get the work paid for, and or work with a coordinating hub, as we call it, so that way that you can still financially benefit from the work that you're doing and not have to physically reside in the hospital, for example.
I agree with all those things. A major benefit is that you have, going through community health worker training, you learn so much about not only yourself, but about community. And we had this project called a windshield survey that I had to ride through the community and have a look at the community without bias and truly understand where I was at. Now, from being in Detroit, Dexter and Linwood, I thought I knew where I was at, but I saw so much more with the windshield survey. And so you have the benefit of knowing that people need access to fresh food, or food, access to transportation, safe bus stops. We want access to healthcare, what's in your neighborhood. We want access to resources that help us with, I like chronic disease management, as you stated earlier. Your community health advocate or community health worker goes through a training that knows these things. So your business, the neighborhood associations, the businesses are going to benefit because you have a person that's one-stop knowledgeable with the lower resources.
Okay, so we just touched on it, and you all did an outstanding job of just giving the examples of how CHWs can be valuable members of the teams and community-based organizations. So can we just kind of do a little bit of education on maybe the role difference in a CBO, like a community-based organization versus a community health worker that's employed by a health plan or that is employed by a hospital or works in those various settings? So what are like the different functions of roles of CHWs in those different settings? Like add some contrast. Give some examples of that.
This is a great one for me to start on. So I'm the author of the I'm a CHW project, and it's really helping us elevate our voice and unify who we are. We have over 150 titles nationally and over 1,000 cultures that we represent. And
You said 150
titles. Yes.
How many other professions can say they have that many titles?
Right, and if you say doctor or lawyer or nurse, even teacher, people I think have a general understanding, but when you say community health worker, sometimes your brain will go to who you know and where they work. I always try to classify it in 3 different ways, right? As a community health worker, I have my lived experience, I have my education or my professional development, whatever it might be in your state. And then more importantly, I have my employer. So my employer is going to drive what my scope of work is for that given period of time. As I mentioned, I specialized in housing. Gary is specialized in other areas and Adrienne is specialized in other areas, you know, so collectively we have this skill set, but where we specialize is somewhere different. And sometimes I think that adds some complexity, but it also adds like the greatest piece of who we are.
I think that says it all, from my perspective.
I agree. Shannon said it all right. All right. So you mentioned that to Shannon. I'll have you kick off the response to this question unless there are any other objections. But you made reference to Medicaid and some of the things related to CHWs and Medicaid earlier in a response. And so as of October 1st, I believe, so a couple of days ago, CHW services are now able to be reimbursed here in Michigan, which is brand new. Get excited, everybody.
Yeah.
So that's a major win. Yes, major win in the policy run. So how do you believe that Medicaid reimbursement will support the sustainability of CHWs?
I feel like it's going to be the exciting piece, right? Because constantly the conversation is we can't employ CHWs because it's not financially sustainable. A lot of it's absorbed capacity building type of benefit. But in Michigan, I've had the privilege, I feel old actually saying this at this point, but we've had 4 stakeholder advisory committees, you can say, over the last 12 years. I have been part of all 4. All 4 have had the same topic of conversation, and we've made like a little bit of headway. About 10 years ago was when we started talking. 7 years ago is when we had the first Medicaid contract language change, and that was pivotal for Michigan. Everybody in the country couldn't believe what we were doing. That just a conversation with 12 stakeholders, and I would say little old me as a CHW, you know, that brought my chair to the table. So many of us CHWs do have a bold spirit to say, you know, nothing about us without us. We're going to sit down here too if you're making decisions about my work. And I was also coming from Northern Michigan, so I was the only one knuckles north, as we call it. But that was when we determined that Medicaid would incorporate community health workers as a provided benefit. And it was 1 CHW per 20,000 beneficiaries. So it was extremely, like, it was huge, but not as impactful as we need it to be. I'm proud to say we're down to, I think, 1 per 5,000, and that number is going to keep going down. In addition to that, having the demonstration projects. So if you kind of, you know, nerded out on Medicaid, we have a lot of different waivers, and we have state plan amendments. There's about 3 or 4 that have been extremely successful that have set the stage for what this is to come. And although October 1st is the date, October 1st is also the date that we are going to start becoming a certified profession in Michigan that we've all been working on again for the last decade. There are only 20 states nationally that have certification for our field, and it's really a big industry standard. It's something to be proud of. It's something we need to especially work alongside medical professionals. But with that being said, it probably won't actually take form until January, but we're all staying like really close and abreast to it. And there's lots of ways to get involved if, again, you're into policy or finances. The biggest thing is to start having internal conversations so that your billers, your coders, your leadership, people are all at the table starting to think about what's it going to take to make change. I know for our hospital systems, for example, to make a simple change to their EMR could take a whole year. And so again, you're starting to have conversations early.
Okay, any other comments about, you know, what reimbursement through Medicaid will do in terms of sustainability for CHWs professional.
To build it out, not only as a profession, but as a state. They had a recent report that was released called Michigan's Path to a Prosperous Future. And Michigan currently lies in the bottom third of all 50 states in 3 key indicators: health, wealth, and K through 12 education. Now, if you compare that and contrast it to the Midwest, we're 9 out of 10. So to be able to build for issues that can improve the quality of life within a household, as well as pay a livable wage to an individual who can provide value to not only a community-based organization, but a hospital, daycare, wherever the case may be that they can be employed for these billable services, it allows us to say, hey, we have something to say. We move the needle towards increasing our impact, not only across the 50 states, but more importantly within our state. As a Michigander, as a Detroiter, when I hear those statistics, it kind of burns me. Like, where have we been and how did we get so low? Because when we look at the news and we hear what's going on, it's always these feel-good stories. But when you go to these community-based organizations, when you listen to the stories at SEMHA, the Detroit Health Department, and things of that nature, unfortunately, that's not the case. And most importantly, in Detroit, most of the inequity throughout Wayne County, 80% of it happens right here in our city. So we have to definitely prepare to become certified in whatever capacity that you are, whether you're a teacher, whether you're working at a daycare, whatever the case may be, to be able to say, hey, I added this to my portfolio and I was able to provide these services to these individuals that I may not have been able to in the past.
Nothing to add, Adrienne?
No, I mean, I'll do this. I'm happy that Shannon's been fighting since the beginning. Because of path layers such as Shannon. These opportunities are available for you, us as community health workers. It's important. You know, I haven't always paid attention to what's beyond the surface of making things happen. And when I became a community health worker, it was sort of like life began to unpeel in the form of community for me, because I get to see so much, there's so many layers to this role. And so having the progress that's taken place, again, I've been here for 2 years. And so putting in the work that I've done over the last 2 years, again, the ground paving that's taken place, it makes a huge difference in what's to come next, because it is an amazing time and a great time to be a community health worker. Thank you.
I'm gonna actually have you hold on to the mic and answer this next question. You know, shifting gears a little bit. You all shared about some of the experiences that you have in serving your communities, and I think it was Shannon, you said that it's tough work. And we all, you know, came through this experience of a pandemic and saw all of the healthcare workers, the doctors, nurses, all of those that were working in the clinical settings, and hearing about their mental health and hearing about the challenges that they experienced, and some of them even going as far as leaving their professions because of burnout, because of just the physical and the emotional toll that that experience took on them. But community health workers, what about burnout for you all? And, you know, how can organizations, particularly community-based organizations, how can they be supportive of your roles and help to mitigate burnout and stress?
Tell your employer that you're tired. That has been the most effective tool in my tool bag when I'm tired, to say, hey, can I work remote today? Or I need to work remote today. And if you have the type of employer that really understands the work that you do, then those days are available. And you know, I'm one of those community health workers that being real and keeping it honest is the only way to make this work really, really work. My first year I burned out. I shared this experience, and It was because I didn't navigate my time properly. I did not have proper time management, which may involve ego, because I can do it, I can do it, I can do it, I can do it, and I did it. However, I had lost my edges, my fingernails were brittle, I was tired, I had circles underneath my eyes, and I couldn't figure out why. And it was because I wasn't asking for help. And in that ask for help, very specific, the type of help that I needed to ask for. And so it's okay to ask for help. As we know this, I come from a mental health background, so to speak, also. And while I have a bag full of tools, so do my partners here. And I may need to ask them for help or ask for experience. When you experience this, what did you do? So I began to exercise. I began to take deep breaths. I began to eat those same nutritious foods that I encouraged I guess the community members to do, because they help. The small things that we encourage others in the community to do is the same work that I should have been putting in on myself. And I had to see it. I had to remove my commitment to saying yes to helping other people, to say, help yourself, do for yourself, and let your team know that, hey, I have this community member that needs this type of help. Are you able to assist me with this? And that too was okay. Sleep is important, coffee is important to me, the coffee to me. But really having a two supervisors that were willing to step up and give me that lift to say, it's okay to be tired. What do you need? How can we support you? I have turned to some of my community health worker partners and say, what did you do? How did you make it out okay? And they're like, oh yeah, it's normal. And now 2 years in, when things come up, I'm like, yeah, that's not anything to worry about. That's the easy stuff. And so it absolutely makes a difference with the experience that you have to find a flow for yourself and truly, truly stand in that. And the self-care boundaries are not to be wavered on. They're like non-negotiable for me at this point. And so if I don't feel that I have the mental capacity to take something on, I will prioritize what I need to do for that community member. Is there need an emergency? Right now, housing emergency. What can we do to get them shelter immediately? And then, excuse me, and then continue on. My voice is cracking, so that's my time to stop and pass the mic. There you go.
Self-care, it's self-care. You know, I love that you said, of course, about the self-care, and using the tools that you have in your bag of tools. But especially about the importance of having an understanding, supervisor, understanding employer. So I'll add to the question. Of course, we want you, Shannon, and you, Gary, to answer this question that Adrienne just answered. But, in addition to that, is there a need to kind of raise a little bit more awareness among organizations that may, or they currently employ CHWs, or they may look to add CHWs to their rosters moving forward, now that we've had the policies in place that they can just, have the reimbursement for the services. So, is there a need to kind of maybe raise some more awareness about who CHWs are and what their needs are? And in addition to, what can be done to mitigate burnout among CHWs?
I wanted to add a different complexity to this too, is Michigan was one of the very few states that when COVID hit and we got COVID money, we were laying off our CHWs at exponential rates. More than 50% of our workforce got laid off and told to go home, we don't need you. You're not qualified to do testing. You're not qualified to go out to the community and do contact tracing. So when we talk about advocacy and like never taking a day off, and our team in particular, everyday life, we never took a day off. And then we also had an epic flood. You ever heard about that up in Midland? So we lost 40% of our housing stock. It was a complete nightmare, literally a month after COVID. Dave made its debut here in Michigan. So a lot of, when we talk about burnout, the biggest thing with supervision is the reflective consultation. And then you have to be emotionally intelligent. And that was often one of those soft skills that was overlooked, especially in hiring leadership in the healthcare system. And now people are finding out that are more emotionally intelligent, aware, supervisors are the best ones for the CHWs. CHWs face a lot of secondary trauma and burnout. I mean, remember, we're not a high paid field. And so although I might be helping you with your needs, I also have needs and I'm going home and dealing with those too. And more than likely I'm helping my aunts and uncles and my sister and my mom and everybody else in my neighborhood because I'm the go-to person. And so work legitimately never shuts off. And so as Adrienne said, and Andrea on my team always calls it taking a time out and giving yourself permission to take a pause. sometimes we really have to do that because you get into this work because you are a pleaser and you are helpful, and like you want to help everybody. And it's hard to say no. It really is hard to shut it off and hard to say no, but it's easy to just go, go, go. And if you completely exhaust yourself, then you really have nothing left to give to the community. And so you gotta take care of yourself too.
Yeah, and from that, the burnout piece, having hobbies, having things that you know, love to do, whether it's hanging out with your family, fishing, or whatever the case may be. Detroit, we're a gritty city, we're a gritty spot. As a firefighter, it's a gritty occupation. Before that, you know, I used to build homes, another gritty occupation. So I've always been in the mix of just making it happen. And I was fortunate enough to be accepted into a fellowship with the Robert Wood Johnson Foundation. And everybody just kept saying, you know, just all these positive affirmations and, you know, let's take a second to close your eyes and breathe. And, you know, somebody's talking about, you know, listen to this. Do you hear the sounds of the birds? And I'm looking up like, we still doing this? Like, oh, I gotta, let me put my head back down. Yeah, I'm like, wow, this is so unreal from where I come from. How do I incorporate that within my life? 4-7-8 breathing method. Breathe in 4, hold for 7, release for 8. And just seeing the impact within your system when you start incorporating some of these self-help meditations and things that you may have just overlooked over the course of your life. Whether it be playing basketball, I haven't played basketball in a while, shooting a hoop with just a loved one, and just seeing how that feels good after you do it. Those are some of the things that you can do to combat that burnout. And with amongst our occupation, I've never met as many caring professionals as ever within this field, whether it be supervisors, co-workers, peers, you name it. It's some of the most caring professionals that I've ever worked with.
So I'm looking at the clock and I think we're making some good time and I'm just gonna riff if that's okay. Alex, I see a thumbs up. And so these questions. Yeah. Sure. So we'll get to the questions in the chat, but I have another question just based on what we've discussed here. So curveball coming your way. These were not scripted questions. So in terms of the profession, we've heard about the strides that have been made here in Michigan, you know, and compared them to other states and really talked about the importance of CHWs and the impact that you all make. If you're talking to, say, someone who's middle school, high school age and trying to figure it all out and trying to figure out what they want to do with the rest of their life, what would be the pitch to consider becoming a community health worker?
When I was in high school, I wanted to go to the Navy. I did not complete that goal. And so that doesn't mean that it somehow won't do that full circle. But I would say, check your heart first. If you have a heart of compassion, I went through a yoga training where we fasted on the saying of love and compassion for all sentient beings. If you have love and compassion in your heart, remind yourself of how important you are and how impactful you can be to society, to your family, to your friends, to the folks in the hospital, to the folks that are in the nursing homes, to the folks that may look like that they are on Skid Row, but just may have missed one payment on their home. Have some compassion. Who do you know that needs love? The child that's in your classroom that's bullied. How can you show compassion? What change do you choose to make? Be the person that you are inside. Make a foundation on that, and the goals that you have in life will come to you. Community health work is not for the undisciplined. It is not for those that don't care. It is for those who choose to listen and communicate. and give with boundaries. That boundary piece is so important, but being able to say, you know what, I want to go to school, but college may not be for me. So I chose the Navy. College may not be for me. And then saying, well, what is it that I want to do? Who can I be? How can I be this person and still make a living for myself? How can I be this person and still give back to my family? Finding the why. And I'll say this, I kind of mentioned this before. I was raised doing community health work kind of my whole life. It's kind of been rooted and implanted to me. As a child, I had childhood asthma. I remember those doctor experiences and the times that they were great and the times that they weren't. I remember seeing my mom cry and I wanted to change those things because the doctors weren't moving fast enough. I wanted to be a doctor to make them move faster. And so in knowing and seeing the things that you are, who you actively are, be that person, grow into that person, be that tree and branch out, give of yourself. This is me talking. I've given of myself so that others can continue the work and can be compassionate. Somebody may be having a bad day. It could be a teenager having a bad day. Well, what's ailing you? What's going on? And it could be a failing grade that they got. Well, that grade doesn't define the work that's being done. It's just a test. You didn't have all the information that you needed at that time, but you still have the tools and resources. So I think I kind of went roundabout, but to say, believe in yourself first, know and understand that everything that you want and work towards will come to you. Being a community health worker is very, 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 very rewarding in spirit and heart, and being able to bring joy to others. So if that's something that you want to do, that you see yourself thriving in as a middle schooler, as a teenager, come on aboard. We need you because we're going to need people to take care of us in the next 10, 20, 30, 40, 50 years. So come on board, share your love and compassion. Sorry.
I'm just gonna piggyback that last piece. We have an aging demographic, and within that aging demographic, it's extremely important that we lean on our youth and that we expose our youth to what our needs are going forward. We see that there is a public health crisis, that we are having more people shy away from these careers. Community health work can be an entry point for an individual to start learning about, some of the things that are wrong within their communities that they may not have understood from the standpoint of just looking at it, just from the standpoint of being ingrained in it. It was normal to them. But a lot of times people don't realize that the abnormal is normal. So how do within that normalization of what can be improved, how do we explain to them that disparities are merely differences, but inequities are things that we can improve upon, things that we can change, and you can be a part of it.
I think you guys summed it up, but I'll just add that I think that was when I realized I was an adult, when I realized that there's no such thing as normal, like at all. And I do really hard. I have two teenagers. I do really good job basically saying, and not using those words, but I remember growing up, family, and you'd hear it even around the neighborhood, like, can't you just be normal? You just be normal. I was like, what is normal? I don't think there's anything as normal.
All right, do we have questions from the online audience, or can we take questions from here, the in-person audience as well? So where do we want to go first? Haley? Okay, you want me to repeat the question? Go ahead.
Thank you. Thank you, the three of you. That was just so insightful. And so I have a question around, Lisa was mentioning now that we're going to have reimbursements for CHW work. A lot of organizations are going to be trying to bring CHWs into their organizations. What do you think they need to know? A new organization, whether it be a clinic or maybe a nonprofit or church, what do they need to know and how do they need to prepare if they want to kind of really integrate a CHW into their organization and have them be effective? Does that make sense? Yeah.
Great question.
Know your why. Know why you need a community health worker. Know what you want your community health worker to deliver. And then be open and trusting to let them deliver. Their job is hard, so you got to have some trust. You have to have the ability to say, this person is capable. I know they're capable. Let me be their support or their guide, mentor, in this role so that we can have an effective, community health worker, so that this organization can deliver to, address the social determinants of health. Yeah, that's.
I would tag onto that too and say, we're not like the new shiny trend. And so you have to make sure that it fits your mission and vision, because you can partner. There's a lot of CHWs that almost camouflage, right? So they'll work through an organization and be employed by another. And so partner strong. It can be expensive if you're a very small organization, billing Medicaid and doing the documentation and the data cleaning and having cyber liability insurance, you know, some of those things where it's like you have to really think through your business model and know that, again, especially in your area, there are partners who you can still get the same outcome by partnering stronger and building the efficiency across networks. And then above all else, you know, just reach out. I know even myself, I put myself out there. I was like, if people have questions, I make myself available. There will be some employer calls that we'll be doing. Somehow is going to partner with us on one to help just answer some questions, hot topic, and get readiness, right? Because everyone's going to be at a different level of readiness. And the other thing we say too is like, you're not late to the game too. Like if you're like, you don't employ a community health worker, there's still plenty of time. And please trust some of those that have been employing for 50 years, they still have improvement areas too. Everybody's improving together.
Okay, we want to go to an online question.
Thanks, Lisa.
Okay.
Can you hear me?
Yes, we can hear you loud and clear.
Okay, great. Thanks so much to the panelists. We appreciate all of your comments. So I'm waiting on one comment from somebody in the chat, and then I'll pose the question that Mr. David Underwood asked of the panel, which is, where can we find the details on the guidelines around billing for CHW services and reimbursements?
DHHS will put out a bulletin and it'll have some of the, I would say, jargon, and then the finer details will come in future technical assistance. But again, partners, there are partners that are going to convene and help to get some of the stuff going. So keep abreast of it. But if you're not getting the bulletins from MDHHS, that is the first way that it'll get announced.
So that's what, over the next few months, we can expect that to roll out from MDHHS?
The initial framework of it is already been a stat that's gone through the emails, and I believe it's on the policy website. If it's hard to find, again, you guys have Lisa's contact information. I'll put her out there so we can always facilitate it. But things can still maneuver and change. But the original recommendations, I don't think the final ones are going to be too far off from what the policy calls were. So there was, I think, 1, 2, and 3. Do you guys remember the policy primers they put out? It was like a YouTube. No. Well, we can get it together.
Great. Thank you so much. Lisa, should I keep going, or do you have something in person?
Just checking, is there a question from our in-person audience? Or can Carrie go to the online questions?
Okay.
Don't be shy.
All right, so we have a two-part question, and this is about clinical trials training and participation. So Mary Ann asked the question, are there any clinical trials training for CHWs?
Everyone's gonna look at me. Does Michigan currently have a clinical trials training specific to CHWs? Not that I'm aware of. I'm looking at university partners. I'm very much involved in the training and technical assistance space. So I was part of a research study 2 years ago that did an environmental scan of all the training programs and specialty paths. There's stuff emerging every day. There's 2 universities in particular and training partners working on evaluations specifically to community participatory research. As far as the clinical trial side, no, I don't think anybody's done that yet. But we can find out, and then I guess I'll put a plug to the National Association, so NACHW.org has a document resource library. Again, we are heavily supporting it. All the CHWs across the country have submitted literature, everything from a flyer to a grant report to you name it. And so that might be a place to do a search and see if there's something in there that I might not know of.
So the NAHW.org document library would be a place to go and check. Cheryl?
community health for them at Wayne State University, there, and I, when the person online, I don't know if she can hear me, talked about a clinical trial, could she talk a little bit more about that? Is she talking about, any studies that would give us some sort of efficacy of, the outcomes produced by CHW?
Okay, so just in case you didn't hear that, Carrie, Cheryl Summers from the CHW Academy at Wayne State was asking a little bit more clarity in the question that was just posed from the person in the online audience about the clinical trials. Are they asking for for the purpose of finding out the effectiveness or efficacy of CHWs being involved with encouraging or navigating patients through clinical trials? Did I capture that correctly? Is that what is meant by that question? So
I'm gonna
hopefully that person. put in the
Yeah,
chat.
thanks, Lisa. I'm gonna default to Miriam and have her respond to that. In the meantime, Rhonda has a similar question in the same vein, so I'm gonna pass the microphone to Dr. Daly. Lisa, if okay.
All right. Hi, Rhonda.
Hello, hello. I guess this sort of piggyback on to Miriam's question, but really as a researcher who have been working with a lot of research assistants, it all boils down to trying to hire people that really have this, can have a great rapport with our particular participants, and also someone we hope that can come from the community. Sometimes that doesn't happen, but how, thinking about Wayne State, Henry Ford, all of these research institutions that exist not only in Michigan, but throughout the country. And as CHW work is being expanded and also being, covered, which is great. How can CHWs participate in research studies where we need people to help enroll folks, also follow up with them? There's a process that we have to go through where we're applying for research. We have to present a budget. We have to figure, and by the time we get to a point where we're ready to hire, we don't have a CHW in the budget. So how can CHWs be involved at the beginning of the process?
This is a great question, and I am a research assistant as well, and I do work with Michigan State University, and so there are many CHWs who have kind of gotten a taste of research. Michigan, first of all, I'll just say as our field of works, I appreciate Cheryl bringing up that question, so I went more on the education side and specialty tracks that CHWs can do as careers. But yes, our field of work is heavily researched, is evidence-based. There's a lot of documentation out there for it. And some of our biggest advocates in research reside in Michigan. So we have a lot of, I would say, like advocates that have helped, again, forge this pathway well before I was in it, well before I was born. And so there are active research efforts going on. Getting involved, I think, is presenting the opportunities. It can be scary, and CHWs aren't always as data-minded as they are relationship-based. And so helping to make it easy to understand and welcoming, I think, would be the biggest thing. There's sometimes a power dynamic when you're around academia or researchers as a CHW, and that can be intimidating. And I know you.
Oh, thank you for that, because you raised some really key issues. I just wanted to highlight the fact that, we're here tonight as part of the work of Checkup. Like I said, Wayne State University Center for Health Equity, Community Knowledge, and Urban Populations. Every year, since starting last year, we start to offer the Community Health Scholars Program. We have one of our scholars here today, and part of it is to bring community members more into research. And we have 5 community health workers in this cohort who are a part of that process, and it's to take people more deeply into research methods and to start preparing them for potentially to have careers in research. I'm a researcher at heart, and we would love to bring more people, particularly in Wayne State University, people from Detroit neighborhoods, to bring them in as community health workers or in other roles, but to work in research. So I just wanted to make everybody aware of that. Right now, we have 12 people in the cohort. They're almost done. They're going to get some hands-on experience now on working on a research project in a certain way. So remember that, so we'll be doing another cohort soon, but we are offering that for Wayne State, and I know I'm sure other places are offering it as well. Can I put you on the spot, but maybe what you're learning now, or? Yes, you're looking for like, no.
I'm loud too, so, I could not do anything but advocate for training like that. I was just at an engagement scholarship, conference in Lansing earlier today with a bunch of universities talking about how do we get it? It's like, we're here, doing the work.
It's not that
helping
hard, right?
people sort of bridge that gap, because research, like, the quality, bridging that gap between the qualitative and the quantitative is so important. Community health workers know qualitative. You guys are gathering data all the time. You have the qualitative, you just need the funding and time to turn that qualitative into the quantitative. And so y'all need to be paid more, elevated more, and I'm so happy that.
Well, and being involved on the front end too, because the way that you ask the question is going to elicit the answer. And then the other thing is the interpretation. I remember one of the first data studies I was on with the ALICE data. Is anybody familiar with the United Way ALICE data? I was on the national review for that several years back, very new into data in general. And so my interpretation of some of the statistics, even for my own county, everyone was blown away. They're like, we never would have interpreted it that way. So our county has, what was it, 57% of two-parent working households. And they're like, that's fantastic. You guys must all be pretty well off. And I was like, and this is why we have a childcare epidemic in our area, and we have one of the lowest third grade reading levels. I was like, so there's all these unintended consequences that you can also get from that. So the way that we interpret the data, because we're the ones working with the families, you know, helps to inform, I think, the next question and what else do we put on the survey to dig deeper. But I'm like, can I be a student? Because I'm really excited to learn more about your program.
It is so good.
We're all enrolling.
Carrie, are there any more questions from our online?
Yeah, thanks, Lisa. We have just a few comments. Miriam said, I live in Dallas, Texas. Please count me in if you're looking for CHWs for clinical research studies. So gracious. And then, let's see. Somebody said, I like your question, Dr. Daly. As an ECR and a CHW, I'm very much interested in research writing. I completely agree with you that CHWs provide a unique perspective that RAs might lack. And then, let's see, lots of activity here. Tia says, you can also submit jobs to organizations like Mishwa and Nashwa, I don't know that I'm saying that, NACHW is the acronym, so they can blast opportunities to their network to get them involved. And in general, just the sentiment from the audience is appreciation for the panels sharing their experience. And it's just a great learning opportunity for everybody here. So I just want to give them a round of applause from our virtual audience here. It's been great. So no other questions unless somebody wants to come off camera and unmute themselves. You are welcome.
There's a couple of raised hands here. So go ahead.
So as a non-CHW, but person in the checkup program, how does one become a CHW, and then how does the new certification, is it a new certification requirement? How does that affect moving forward? And then how do we also partner and develop them? So all those questions.
Yeah, okay, just in case the online folks did not hear the question, it was just about how does one become a CHW? And it was the certification. Yeah, did the certifications requirements change from before? And then how do we partner?
Thank you, Lisa. Okay. Thanks, Lisa. That was very helpful.
I think I have those all, but this is the work I live and breathe, and like I said, very, very proud to be a CHW here in Michigan. The first question, repeat that one.
How do you become a CHW?
My brain, I'm getting old. I tell you, my brain will in one ear and out the other. We as CHWs talk about how we're born, not made. And so there shouldn't be anybody saying that you can or can't be a CHW. That's only for you to decide on who you are, and is it within you? It's not something that can be taught. I really can say that, and I can say that more than once. You really can't just go to school and figure it out and then go to the community. There's something within you that lights up. As far as the practical side of, back to those 3 pillars that I talked about, our lived experience, our training and professional development, Michigan has several training opportunities. And so it's not a one-size-fits-all state. Pick the one that works best for you. Training is your certificate, so that's your training. Certification is different. Training and certification are 2 different things. It gets really confusing because they both have certificate in the language. So I, like many others, am also kind of waiting on, what does certification look like? How much is it going to cost? What is going to be the application? As soon as that stuff is ready, it is going to get announced pretty rapidly, but I have full confidence, and I can tell you, just being on the advisory committee for MDHHS, that there's been no talk of any individual who has a training certificate in Michigan not being eligible. Everybody who has trained in Michigan thus far with one of the training partners is eligible. So hopefully that answers it. So you don't have to train again. I always get that question. Do I have to retrain? You do not have to retrain.
So find a training partner to get the piece of paper, do things that you're probably not.
Yes.
doing if you're.
Training will be a component of certification. Experiential hours will also be part of it. And so that's where we always say training and certification are different. Arkansas, for example, has 2 years. You have to work for 2 years. And so they don't come hand in hand, which can make people a little bit nervous because they're like, well, I want that certificate to be my certification, and it's not. They're 2 different things. And then getting involved.
No, partnerships, like where my organization, we don't have a community health worker currently. I would probably fall into that role.
Yeah.
But so here is the thing, our things.
Right.
So I preemptively not take on more stuff. So who's partners? Where do you find them? How do you get involved?
Yeah, word of mouth, but I would say in this room, you've got strong partners, and definitely lean on them, and we're all connectors. So if Adrienne doesn't know the right answer, she's gonna go to Gary, who might go to me, who might go to Lisa, or vice versa. And so it's like it's a big game of telephone, or what have you, when you're a kid, you think those games of how we get connected, but yeah, the opportunity's there.
And I would like to take credit for Shannon being here. And it all started, it all started, I was listening to a podcast, and I have been deep within the CHW piece for a few years and was trying to connect the reimbursement piece. And she was just a wealth of knowledge. I'm like, oh, I'm reaching out to her. LinkedIn, bam. And then from there, wound up finding out I was already in the same network with Andrea. And then from there, everything just kind of came together to where I passed the ball to Danielle Hilliker, who is the CEO, president, and then everything has just kind of been coming together. And she had already been working with the state piece, so I was able to be part of the state team as well. Currently working as a CHW within their national, their statewide blowout as far as CHWs across the state. I think it's 65 or 70 folks that are representing community health workers, and we're getting the word out as to the occupation, as to the opportunities, as to the enhancement that it can provide, not only community-based organizations, but families, communities all across our state. And once again, it's so important for us to raise from that bottom third to get within, a livable point to where we can say we're all living our best quality of life.
What I'm hearing is, Gary, that if you're gonna come help me do this, right?
Yeah, I got folks to lean on. We got it. Nothing without us.
Yeah.
I
Nothing
think,
about us without us.
Yeah.
so I think, Carrie, your hand is raised.
Yeah, well, let me ask Rhonda, we want to go ahead because she had that question first, and then I'll go.
Sure. What is the average hourly fee or for CHWs? And also, should we think about fringe benefits when we're considering? Because I'm serious about this research and trying to have CHWs involved, but you know, we need to know the numbers. We need to know these things.
I'm just gonna say, you know, a livable wage. You know, that's been the talk around town for a while. Making sure somebody has family sustaining, you know, wages. Always, fringe benefits are always welcome, whatever capacity that you can provide them.
I would say just the equity piece, if you're offering, you have to offer the same benefits that you're offering your other employees or contractors. Michigan, again, has a lengthy history of research, which is wonderful. And so our last research report, I want to say the average salary was $18 an hour for community health workers. It is in Michigan ranging from $10.50 an hour to $28 an hour, depending on the type of work and kind of what we call a tier of work. So how many years have you been in your role and what type of responsibilities do you have? But that's shifting rapidly. I always take a personal opportunity and I do ask the question, you know, how much are you making? Do you have benefits? Do you work full time? What are some of the things that keep you in your job? And we help to share that knowledge around. Again, back to a lot of CHWs are doing this in a volunteer or underpaid capacity. And so we want to make sure that in Michigan, we are employing our CHWs and the comprehensive benefits. The other part too, I would say back to the partnering stronger, there are a lot of agencies that contract out their community worker teams. And so if it's one of those things where you need to try it before you buy it, and kind of learn it and be mentored, that's another area to kind of partner with one of those employed hubs.
Thanks so much. Okay. Should I continue, Lisa, or how's the room looking? Because we still have questions coming from the audio. Okay.
But we have someone who has raised her hand here in the room.
I just had a question about any elected officials that support this movement in CHW, and are there any legislation or any bill out that support?
Okay, so elected officials who are currently supporting and advocating for CHW professionally and otherwise in current legislation that is being considered in Michigan.
I'm always in their ear advocating for CHWs. I can't confirm nor deny, but always advocating.
I was going to say that part. So my role is really unique because when it comes to elected officials, in my role, there are clauses in place that I cannot have certain interactions. And so in the district in which that I serve, our councilwoman hosts bike rides. She supports having a healthy community. I can state that a center such as this one, I've been looking at this check on the back wall here. We have an elected official, it looks like that has made a donation. So there are partnerships such as that that take place that make spaces like this available for people to come to receive the resources here and pass it over.
How do I get my elected official? Maybe that should be a better.
Educate on community needs, and when there are capital days, get involved. So historically, Michigan, we've done it. I helped to organize the first one. I think we're on our fourth one, and I don't see why we wouldn't do one again in the spring. The National Association had our first awareness week. That's going to continue. It's always going to be the last week in August, and that's a way to educate. So we need to educate our officials on who we are, what we do, that our workforce is unique and it is necessary and it's evidence-based. On the national scene, it gets a little complicated because I'm the policy chair for Nashua, so I can put that hat on for a minute. Most of the federal stuff that's coming out is not calling us by our name as community health worker. And so we've done a lot of advocacy and education, helping to encourage changing of language, which will also help our local officials so that we're speaking the same shared language. Senator Casey is the only one who is not in our state that I've seen named on specific things and involved, but it doesn't mean that there aren't others involved across the country. It's a rapidly moving topic right now, also because CMS and CDC are starting to invest in social determinants of health, and we're directly tied to that. And so I would say more to come. But it's going to start with you, right? Your official, I probably guarantee, does not know what a CHW is. And so I would start with the education piece and having them get to know you, right? And build a relationship with why you matter and why your community matters.
Can I just, I don't know if you all know, but this was a few years back. I think she's a state senator, Erica Geist. Yeah, okay, so she knows. Yeah, she knows because she was very much involved with advocating for doulas. And for support for doulas. So she's well aware of this type of profession because doulas fall underneath. They're a type of CHW. So I think, yeah, you have someone who will have a listening ear. And if not, you can remind her that she did the stuff with the doulas.
And I didn't say it, but we have no current bills, right? There's nothing to ask them to support at this current moment.
And another resource outside of CMS and CDC, the APHA, tons of research. Like, this is not a new emerging field. Community health workers have historically been around for generations. So there's evidence base that can say the word for the word.
Okay, back to you, Carrie.
Yeah. Thanks to everybody. That was my question. Have any of you been involved in, tying the work to action and advocacy? So that was really exciting. Thanks for addressing my question. More questions from the audience. We have Henry wants to know, are there many African-American male CHWs currently serving? And is there a need for more African-American males as CHWs?
I'm gonna tell you where it goes. In my class, during my training, there was 2 African-American males in my class. We had like 20 students, only 2 of them were African-American. Our community faces a lot of issues, and African-American men are not visible. And I'm going to pass the mic to the visible man.
Yeah, when we did a national survey of the demographics, and that is one of the smallest demographics are African-American males. And within that, I think the importance is to meet people where they are. And from a lived experience perspective, returning citizens, there's a big push for returning citizens to be trained as community health workers. They have the same issues we have. Returning home, they're going to have more issues. What better population to talk to that group of folks than folks that have that lived experience? And I think from the standpoint of community violence, I mean, we can go on and on. We definitely need more Black men at the table.
As a national training and technical assistance provider and just networker, we're always really excited, and we never knew it was a thing, but we have 7 through our staff contractors and strategic business partners, many of who I know we share relationships with. We also have 2 Hispanic males. And it never really dawned on me, obviously being a white woman, that was a deficit, basically a disparity that we have right now, until somebody brought it up. They're like, how did you hire them? How did you find them? And I was like, what do you mean, how did I find them? I was like, I didn't find anybody. I was like, we're kind of a collection where people just come together naturally based on, our base shared knowledge and our excitement for the work. And so then when we really started looking at it and back to Gary and the data, I was like, wow, I know like 4,000 women in this field, and most of them are women of color, and so I never thought on the opposite side that we really don't have enough males, and we need more of them. We also need more males who are older. So really helping with our aging population.
So Mr. Cade, who asked the question, maybe that's a little bit of motivation there for you to come on and join in and be a CHW.
That's what I was going to say exactly, Lisa. It sounds like Henry is a viable candidate for recruitment here. Okay, and then you all already answered this question, or was dialogue in the audience about the resources for reimbursement and billing. So can we maybe share that information with all the participants later? Because it doesn't seem like we've captured it in the chat. Maybe when we send out a follow-up survey or something, Alex could include those resources in the email, because it sounds like that question about reimbursement and how to learn more about that was already shared. Isn't that right, Shannon? You already talked about that. Yeah. Okay.
Yes, there's been many things that have gone out. The official bulletin has not gone out, and we're all watching our emails very anxiously. And then I just want to make again another plug that there are employer partners that are coming together. I know Everyday Life, our team's going to host some of those conversations and learning labs, and Semha is going to partner with us to also host one, because it's going to take all of our brains around the table to share ideas and think about how we implement it within our own organization, because it's going to be unique to each person.
Last question, Lisa, approved?
Okay.
Okay. This comes from Elena. Is it beneficial for those who are already degreed or those who possibly aren't degreed but have higher leadership roles in their industry? Is it beneficial? Elena, does that question? I'm passing the mic.
I'm sorry, to become a CHW worker. So for instance, if you have a associate's, a bachelor's, a doctorate, or if you are in your leadership role as a program manager, a director, possibly even a CEO, COO, program coordinator, like at what level would be the recommendation for those to participate in the program? Because I know when we mentioned, like, it is for the underserved population and it is for those we don't have a lot of them, but for when people are considering going through the program, to be considered when you're doing it from an organizational standpoint, who would those be that I guess would be recommended, or you want to see more of that it would be beneficial to?
I'm going to answer full circle. It's going to go full circle. And so the first requirement for being a community health worker is not your resume. It is your compassionate heart. Secondly, I have a degree in journalism. I'm a writer, but my heart is what keeps me as a community health worker. I've been a banker, I've been a teacher, I've been a lot of things, but my heart is a community health worker. I'm a successful community health worker because my heart is in it. No matter my degrees, no matter my certification, I've been able to transfer all of my skills, even as a banker, into being a community health worker, because does a person have access to economic stability? If not, how can we make sure that their ends meet and that they have groceries? Who can we connect them to? So how well, if you are a leader, if you are in leadership and you're a CEO, how strong is your network? Can you transfer your network? If you are, whatever your role is, do you have compassion? Can you transfer your network? Can you use your network? And how will you apply it? That is the response that I have to transferring careers. Your degree doesn't matter. When previous degree does not matter, but where you start is what is most effective. I've seen most effective in community health workers starting as a community health worker. No matter where you've been, you have the opportunity to go places that you may never even thought that the career could take you, because you're leading with heart.
I agree.
As a training organization, we get this question a lot because there are some states that you cannot take the training if you cannot demonstrate that you are completely tied to the community and are not in a leadership position. Neither here nor there, whether you agree or disagree on the context, the advice I would give is the why, right? Why are you taking the training? We offer a supervisor course, for example, or we offer a leadership course where if you want to know the knowledge so that you feel empowered to help support the community health worker, because this is not information taught in traditional clinical education, I would encourage you to take that path instead. If you are in a rural clinic, there are a lot of times, our rural health centers in particular, physicians are often cross-trained. I mean, it's the work they're doing because they're one person. When it comes to billing and coding, if that's the motivator, you're not going to get the outcomes you need, and it won't be effective. It'll be really stressful, burdensome, and we're going to burn out our providers. This is not transactional work. It's very much relational work, and we want everybody operating to the top of their license. And so that's another reason to integrate a community health worker into your established care teams in particular. But out of curiosity, I mean, we're all adult learners. So if you're interested in taking it and you want to put aside kind of like your ego and whatever degree you have or your hat that you're wearing that day, and you really are that person with a heart and you want to participate, then absolutely do it. We have trained some phenomenal CEOs and supervisors, and they absolutely loved the class and became part of that family and have a better knowledge base and skill set to apply in their community.
And finally, Shannon, could you just name 5 or 10 of the 150 different titles that CHWs have?
5 or 10.
Oh my
5,
goodness. Well,
3.
in Michigan, I will give respect to our skilled trades. So our community health workers are umbrella term, but we have specialized tracks. So in Michigan, we do have our doulas, we have our CHRs, which are community health representatives. We have peer supports, recovery coaches. Kind of in our nonprofit sector, you know, we have a housing liaison, a family support, an outreach worker, community navigator. What are some other? I'm gonna pass
people
on.
in the hospital, the caseworkers? In the hospital, you have the caseworkers, the persons that are looking for housing for people that come into the crisis center. We have clerks in the hospital that help out. Let's see, who else do we have? Let's say, for example, the doulas. I like the doula conversation. We need that person to be in place so that the babies can come earthside healthy. Who else am I missing? The firefighters.
Firefighters, yeah.
Peer support specialists, neighborhood resource navigators, police officers, the chaplains that work for the police departments. Who else do we have?
Well, community health
Is that
workers are
5 or
here.
10?
And
Yes. The list goes on. All the people that help others without bragging about it. Those are your community health workers. And us.
Thank you. That's everything from the online community. We thank you so much.
All these hands.
Carrie, I was gonna add one of that too, because this was a kind of a political conversation at our national committee. I'm a CEO, I am a business owner. A lot of our CHWs are entrepreneurs, and I was gonna say that's one title that often got overlooked, and we were actually told in one meeting, you know, well, you can't be a CHW and a CEO, and I was like, but there's a lot of CHW owned businesses that are still doing CHW work, and so don't want to be dismissive of that title.
Good point, good point. So, ma'am in the back, we'll come to you with your question. I saw you, and so we're gonna go as quickly as possible because we're at time. So, did you want to ask your question? Okay, yes, I love it, I love it, I love it. When do we start with classes? Okay, well, certainly you can visit with Shannon after we wrap up and see, yeah, how can you get hooked into becoming a CHW? I'll come here.
Where can we find you guys?
Yeah.
You have like social media handles or phone, emails?
And we're connected with one another too, so if you only find one and don't find the other.
Okay.
All right. So I think we have had a wonderful evening together talking about this important topic. So can we give our panelists a round of applause? So thank you all for joining us.